Have you recently been diagnosed with Hashimoto's thyroiditis and you're wondering if some of your symptoms might be related to this new diagnosis or if it's something else? My name is Dr. Terranella, and in this video, we're going to look at what some of these symptoms are related to Hashimoto's disease. Some of the symptoms can be hyperthyroid, some of the symptoms can be hypothyroid. We're going to discuss both and also look at some of the non-traditional symptoms of Hashimoto's thyroiditis. As I said, my name is Dr. Terranella, and if you're new to this channel, I just want you to know that I'm making these videos because I enjoy helping people go beyond the basics and get to that optimal health state. Whether it's a confusing lab test, diagnosis, or symptom, I enjoy helping people get a better understanding of what's going on with their health. So if you like this kind of information on nutrition, health optimization, hormones, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's look at what are Hashimoto's disease symptoms. So what are Hashimoto's disease symptoms? As previously discussed, Hashimoto's disease can present as hypothyroid symptoms or hyperthyroid symptoms. Most commonly, though, it is going to be the hypothyroid symptoms. We'll cover a little bit of each in this video. Let's look at the least common first. So hyperthyroid symptoms are going to be hot flashes and intolerance to heat, rapid heartbeat, sweating, weight loss, tremors, anxiety. Think of adrenalinated, very hyperactive state, anxious, just overall not feeling good. Sometimes there can be headaches, digestive issues like nausea as well. Depending on the severity, will determine how many of these symptoms and how bad they are. One of the most common ways to pinpoint what's going on with someone clinically is just by checking their pulse rate. Now, this isn't always going to happen from hyperthyroid, but if your pulse rate is in the high 90s or even in the hundreds, and you do have other hyperthyroid symptoms, the chances definitely go up that it's hyperthyroid. So in the case that you have more of the hyperthyroid symptoms, that state is going to be triggered by the autoantibodies that are stimulating the thyroid to make more thyroid hormone. In that case, the more of those autoantibodies present, the more stimulation to the thyroid to produce more thyroid hormone. So when there's more of those antibodies around, there's more thyroid hormone and you're more symptomatic. And that can ebb and flow throughout the day. Hypothyroid symptoms are kind of the opposite. So it's going to be more like fatigue, tired, generalized sense of malaise, muscle weakness, sometimes pain and aches with that, weight gain, and an inability to lose weight. And then on hypothyroid, instead of heat intolerance, you're going to have cold intolerance. Sometimes there's depressed mood, which goes along with the fatigue state. Hair, skin, and nails can also start to become brittle, dry, and fall out. Other hypothyroid symptoms that are a little less common include constipation, swelling in the legs, and sometimes around the eyes can occur in some people. So again, because there's an autoimmune component to Hashimoto's thyroiditis, the symptoms can fluctuate from one day to the next. On the hypothyroid side, this is because the autoantibodies are interfering with the production of the thyroid hormone. And again, the more of them there are, the more interference. For instance, one of the common autoantibodies used to track Hashimoto's disease is the anti-TPO antibody, also known as anti-thyroid peroxidase antibody. This enzyme itself is responsible for making the thyroid hormone. So an antibody against this enzyme is going to directly interfere with the production of thyroid hormone. Now, if the production of that antibody was static, the amount of Hashimoto's symptoms would be static as well. So since the production of those autoantibodies is not static, the symptoms are going to vary as well. So one thing we do to take out these hyperthyroid, hypothyroid symptoms and take out the highs and lows of that is to give thyroid hormone replacement. Depending on where you're at in the disease process or progression, you may not really need thyroid hormone replacement. Now, sometimes Hashimoto's thyroiditis takes on more of an autoimmune type of symptom presentation. More joint aches and things like this, whether it's in the hands, knees, elbows, can really be in any joint. These types of symptoms are commonly seen with autoimmune conditions like rheumatoid arthritis or lupus. However, with Hashimoto's thyroiditis, because there is autoimmune activity, some of that inflammation or increased immune activity can be directed systemically and not just at the thyroid itself. This is even the case when there's no other diagnosable autoimmune condition present. Usually, once treatment begins, this systemic effect is greatly reduced. So, how do you know when you actually have Hashimoto's thyroiditis and not some other autoimmune disease or simply have hypothyroidism? That's what we're going to look at in the next video on this topic about Hashimoto's thyroiditis. So, how did I do? Does that help explain what are Hashimoto's disease symptoms? Let me know in the comment section. Maybe there's additional questions, symptoms you want to know about, how they might be related to this diagnosis of Hashimoto's disease. Drop it in the comment section. I'm happy to answer your questions. Thanks again for watching. We'll see you next time.